and helpful technique that I learned is suboccipital stretching. That's where you take the patient by the occiput and just gently give a little stretch. Piece of cake, right? Easy. What do you feel?
Not much.
Not much? You feel a little pulling or stretching or anything?
Like the base of my neck.
Okay. This is the nicest stretch. It helps take some stress off. It might be a little manual distraction, maybe decreasing the amount of tension in the muscles of the neck, take some pressure off some of the nerves. Let's face it, this is boring. Who wants to do this for 3 minutes? All right, take those legs, make them straight. What'd you notice?
It started getting tighter.
Get an increased pull there. That's better. I like that, right? How many of our patients recognize that their neck problem isn't entirely coming from their neck? It comes from all the different parts. All right, so let's go knees bent, feet flat like we started. Let's see if there's a relationship. We already proved there's a relationship between her lumbar spine and her neck, because when she straightened her legs, she went from a position of lumbar flexion to a position of lumbar extension, and that manifested itself as increased stretch. All right, so I still haven't moved my hands at all. Now I want you to take your knees and just rock them to the left side. Little lower trunk rotation. Think about what you're feeling in your back or your hips or anything like that. What do you feel?
Like stretching my lower back.
Feeling in your low back. Do you feel any increased tension in your neck?
Not really.
Not really. I kind of think I feel it, but I'm not sure. But just the same, let's go to the other side and see what happens there. What do you have with that?
Not really a change.
No change at all. Okay, so let's go to right rotation. That's fine. Go ahead. That's right. Now let's go back to left rotation. Yeah, that's definitely increasing your neck stretch. Agree?
A little bit.
A little bit, yeah. But you feel the stretch down through your back.
Yeah.
Acknowledging that the tightness in the right hip and the low back are a little bit linked to the tightness in your neck. Okay. So you can just slowly go back to the middle. And on your own, I want you to rock to the left. And then back. Increase the stretch and decrease. It's a nice way to get your patients more actively involved in their rehab and to do their own suboccipital stretching. Now, how do they do that on their own? Well, what you teach them to do is to cup their fingers, just like this. Cup the fingers, just like this. And you're going to put that behind your head. Get that hair out of the way. You do not need to shave your head for the purpose of this treatment. But your hands and your head need to become one. Slide that back. You feel that stretch?
Yeah.
Can you maintain that when I let go?
Yeah.
Okay? Pretty good? Now you'd want to do that rotation, rocking those legs to the left. Increase the stretch all the way through. And then at some point, let's do 2 or 3 of those more. And then go ahead and straighten the legs out. That again causes a little increased pull. Do you agree? Okay, so that's a nice stretch. And just a better take on what is otherwise a boring suboccipital stretch.